Hi, my name is David Wagner, Dr. David Wagner. Students all call me Wags, which I like to be called. I am a physician who's been around longer than all you guys who are looking at this video have been around. And my life in medicine has had a number of phases, including general medicine with the Native American population, being a trauma surgeon, being a pediatric surgeon for 2 medical schools, and then getting involved with emergency medicine before I'm now back full circle working with medical students in the first and second years of their careers and spending as much time as I can at the Streetside Clinic. Streetside has a unique set of patients, or clients as they're sometimes called, that will make a very valuable addition, in my view, to first and second year medical students' experiences. These patients are very often having a complex, what are called biopsychosocial set of issues revolving predominantly around lifestyle and some of the issues that occur with substance abuse, addiction disorder, and living on the street. The patients will arrive with a varying set of wounds. Wounds that are related to the use of needles and injection of drugs will predominantly be anywhere from the neck to the extremities to the lower extremities, and can involve anything from small, simple areas of infection, cellulitis, to large abscesses that may contain 10 or 15 cc's of purulent material. Patients arrive with these wounds because Streetside offers a friendly environment in which they can be managed on their own turf. And many times these patients are resistant to go to a more sophisticated area, such as an emergency department, because their reception there may not be as welcome, and they feel that they may not get quite the consideration that perhaps we're able to offer them in the Streetside setting. It is also very useful for students to realize that wound management can occur with very limited resources, and it can be carried out, although not ideal, it can be carried out in a very satisfactory fashion. So what does this entail? First, it entails that you need to recognize that wounds, the ideal treatment for most wounds is to have available soap and water. This is a premium for people living on the street. Mostly they can find an opportunity to at least get access to soap and water maybe once a day, but not in the usual way that we would like to be able to manage wounds. So what do we do? So we have an opportunity to make certain that any wound the patient presents with at Streetside is adequately incised and drained if in fact pus is present. We are able to provide antibiotics as necessary for cellulitis or inflammation when pus is not present that should be drained. I emphasize again, if pus is present, we should always drain it or make specific arrangements, if it's more than we can handle at Streetside, to refer a patient directly with a personal note to an emergency department to see that this wound is drained appropriately. Following drainage and our management of the wound at Streetside is to get it as clean as possible and then rebandage it so that the patient can have some protective covering while they are on the street, or until they can manage it, hopefully by themselves for a few days, and then return for us to see. It is an opportunity for you, students, to advise your patients/clients into how simple management of wounds can occur with their limited resources, and to encourage them to return if wounds are not improving. One of the particular things that you will find at Streetside is that patients will present there and open up to you because you are seeing them on their turf, as opposed to their coming into the emergency department where they are being seen on our turf, which is typically our turf, and in which, as I mentioned earlier, they may find a less caring and empathetic environment. So we give you this opportunity to get comfortable with talking about lifestyle issues with patients on their turf, which they will be much more willing to do than perhaps on a less friendly and empathetic turf.